Ashley, and I'm going to discuss the definition of pet therapy, why we would use pet therapy, our group's reason why we selected pet therapy, different types of animals used in pet therapy, training for the dog, and requirements to institute pet therapy into our healthcare facility.
Hi, I'm Lynne, and I'm going to be discussing pet therapy as it relates to the 3 roles of the nurse, the psychological and physiological benefits of pet therapy, and how it can benefit special groups.
Hi, I'm Renee. I will be discussing how pet therapy relates to Healthy People 2020, impacts on nurses and doctors, as well as evidence-based practice of pet therapy. And
Miley will be playing the part of the dog therapist.
Pet therapy overview. First, we're going to talk about the definition of pet therapy. The definition is an interaction that is guided between an individual and a trained animal to help with recovery from an illness or to learn a positive coping skill. Pet therapy is designed to promote improvement in human, physical, social, emotional, cognitive functioning. It's a form of complementary or alternative medicine. Pet therapy can be conducted individually or in a group setting. A licensed pet therapist supervises the interaction between the patient and the animal. Next, we're going to talk about why our group selected pet therapy. Our group is very passionate about animals, and as nurses, we wanted our patients to get the best possible therapy. Next, we're going to talk about why we would use pet therapy. It is a well-documented supplemental option to traditional treatment programs. The nurse advocating pet therapy has the ability to augment his or her roles as a provider of care, manager of care, and member in the nursing profession. Pet therapy has proven physical and psychological benefits. Pet therapy, in a form of canine-assisted ambulation, promotes mobility, wellness, and an overall therapy compliance, as well as supports shortened length of stays and overview cost reduction. In the vast majority of cases studied at clinical settings nationwide, patients benefit, the healthcare effectiveness improves. Let's talk about what types of animals are used for pet therapy. Dogs are used to help build self-confidence, increase communication, improve mood, lower stress levels, and stimulate exercise and activity. Horses are helpful for mental health patients with disorders such as depression, anxiety, low self-esteem, eating disorders, and post-traumatic stress disorder. Cats can reduce stress and lower blood pressure. Birds are typically used in a long-term care facility in dementia patients. Fish are useful for Alzheimer's patients. For this presentation, we will be focused on dog therapy. Now let's talk about training. The dog should be calm and able to follow simple commands like sit and stay. Handler should be able to keep the dog focused on himself or the task at hand with the distraction of other people walking by. Most organizations require the dog and handler to pass an obedience class along with the Canine Good Citizens test and the therapy dog test. Then a temperament test is given. This test ensures that the dog is able to remain calm in difficult and distractive situations. You can expect the dog to be exposed to a variety of distractions. Those distractions include a wheelchair, walker, and medical equipment. Requirements to institute pet therapy into the healthcare facility. First, there must be realistic goals and expectations. To avoid program failure, possible problems, and their solutions should be worked out ahead of time. Cooperations from all disciplines must assure successful completion of program implementation and program goals. Selection of the animal should be considered in relation to what type of facility it will be used in and what population. Only animals that have known medical and behavioral histories and that are trained using positive reinforcement should be used. Animals should have proper immunizations and license. Safety of all visitors, staff, patients, and the animal is most important. Therapy sessions should be supervised and any stress on the part of the animal should be addressed quickly. The animal should be given the opportunity for some quiet time if needed.
Benefits to special patient groups. Therapy dogs and other animals can stimulate social interaction and ease agitation, which is common in dementia patients. Patients have also been shown to eat more following a dog's visit. Pet therapy helps Alzheimer's patients deal with their feelings of loneliness and isolation, as well as relieve depression and disorientation. Interacting with pets provides an opportunity for positive nonverbal communication. Memory-impaired patients may withdraw from people, but find animal interaction easier, less painful, and non-threatening. They enjoy the presence of the dog and find pet interaction to be soothing. They benefit from the physical contact provided by contact with a pet. Clients with aphasia often have to be motivated to communicate because they are hesitant or embarrassed about their speech difficulties. The dog may act as a unique catalyst to motivate the client to talk and provide an atmosphere of unconditional acceptance. Studies have found that pet therapy helps autistic children have an increase in socially appropriate behavior, show fewer autistic behaviors such as hand flapping, humming, spinning objects, and jumping. They were more focused and more likely to engage in conversation. The pets can help Down syndrome patients learn more about gentleness, following instructions, and how to care for other living things. Many special education classrooms have a variety of animals and may have visiting pets as well. The physiological benefits of pet therapy. Neurochemicals. The touch of an animal increases the release of endorphins in order for the body to relax. The spirit of a person is then able to interact with the mind and the body to establish a serene state. Cardiac benefits. A study on hospitalized patients with heart failure measured hemodynamic values, hormone levels such as norepinephrine and epinephrine, and anxiety. 2 groups of patients were studied. One group had regular therapy dog visits. The second group did not. The results showed an overall decrease in cardiopulmonary pressures, neurohormone levels, and anxiety in the group that received a visit from a therapy dog. Let's discuss a specific mobility research study. In a 2011 study by Abate titled Impact of Canine-Assisted Ambulation on Hospitalized Chronic Heart Failure Patients, Ambulation Outcomes and Satisfaction, a 537 patient hospital studied. Historically, 28% of patients had refused to walk, and those who did not refuse walked approximately 120 steps. When a therapy dog was introduced and the patients were allowed to walk with the dog, the refusal rate dropped to 7% and the amount of steps taken increased to 235. The study further observed positive emotional feedback from the heart failure patients as well as their interest in using pet therapy again. Compliance with standard early-stage ambulation therapy was higher for the sample when also given the pet therapy option. The study suggested that length of stay and hence heart failure care cost could decrease with the use of pet therapy. Studies have consistently reinforced patients' physiological and emotional improvement due to increased mobility stimulated by pet therapy. A look at the psychological benefits of pet therapy. Animal therapy can help depressed patients by promoting humor and providing unconditional acceptance. During pet therapy sessions, dogs can help patients decrease anxiety, increase attention span, and remain calm. Perhaps the most simplistic yet powerful benefit is the ability of the animal to provide touch and give affection to the client. Counselors are limited in their ability to provide therapeutic touch. Caring for those who have been physically or sexually abused is sometimes challenging because they do not like to be touched. An animal in this situation gives the abused the opportunity to touch, hug, and hold, which reinforces appropriate contact. Role of the nurse in pet therapy as a member within the profession. Nurse educators need to teach methods, techniques, benefits, and risks of how animal therapy can be part of a nurse's plan of care. Increasing education about the uses, benefits, and research on pet therapy to the multidisciplinary team will increase support and approval. To create a policy, the following must be accomplished: assessment, establishment of goals, and acceptance within the hospital. Most of the research deals with pediatrics, elderly, nursing homes, and psychiatric units. Research needs to be done more in the critical care and community settings. Now, let's watch the nurse as manager of care during the interview. A thorough evaluation should be done to see if the patient is the proper candidate for pet therapy. Criteria for consideration includes allergies, fear of animals, dislike for animals, culture, religious beliefs, and the patient's condition. It's the responsibility of the nurse to perform a thorough assessment, including the patient's willingness to include pet therapy in their plan of care. The patient's care plan and his deficits will determine how animal-facilitated therapy can be used by the nurse. The therapy should be modified or canceled based on the evaluation of the progress towards meeting identified patient goals. One of the most vital roles and responsibilities of the nurse is to be a patient advocate. Advocating involves providing support for the patient's best interests and encouraging and integrating the use of animals as a therapeutic intervention. The nurse must collaborate with other healthcare disciplines in order for the patient to receive necessary, coordinated, and timely therapy. Priority or emergent treatments should come first. The nurse should cancel or postpone pet therapy if a patient is in need of more aggressive attention. In the role of the nurse as provider of care, nurses can use pet therapy for many of their patients for all different kinds of benefits. To improve skills needed to perform activities of daily living for patients with musculoskeletal, respiratory, neurological, and cardiac disorders. To improve a patient's coordination, flexibility, breathing status, and muscle strength by walking the dog short distances or combing the dog's hair. Psychologically and emotionally, to decrease feelings of sadness, depression, loneliness, and stress. To make depressed patients feel more important. To increase a patient's motivational level and provide pain relief and reduced use of analgesics.
Okay, so now we are going to discuss how pet therapy relates to Healthy People 2020. Committing to walking a dog daily supports Healthy People's 2020 topic of physical activity. Increased awareness about the benefits of pet therapy will increase the population of people who will make the decision to introduce a dog into their life and commit to a lifestyle change that could promise improved physical health through increased activity. Furthermore, adults who demonstrate increased activity model a culture of physical well-being that can span future generations. Regarding Healthy People 2020 topic of mental health and mental disorders, pet therapy supports Healthy People 2020 objective that states reduce the proportion of persons who experience major depressive episodes, whether through pet ownership or therapy with a pet. Patients that are depressed, sad, lonely, stressed, or very withdrawn can be helped by pet therapy. Including pet therapy in mental health patients' plan of care exposes the patient to possible positive outcomes, and the opportunity to continue working with the animal as an outpatient or through pet ownership. Heart disease and stroke is another topic in Healthy People 2020, where pet therapy can support interventions to improve cardiovascular health. Pet therapy research studies have proven numerous times a decrease in patient blood pressure when petting a dog. Physicians have known to suggest that patients consider the addition of a companion animal for its therapeutic effects on cardiovascular health and related systems. Animal facilitated therapy has been researched, and findings from those studies showed that physically touching a pet decreases blood pressure, anxiety, stress, and hopelessness. Researchers found that study participants who interacted with pets had lower blood pressures compared to those interacting with other people, including family members. Okay, so let's talk about impact on nurses and doctors. It reduces stress. It reduces stress on the patients, patient family members, and even staff. Improved morale. Some nurses choose to work at facilities that actually have pet therapy because of the improved staff morale. Communication. Ability to facilitate conversations, lead to discussion, or a break in communication barriers. Small talk can lead to more open-ended questions regarding patient health problems or any other patient questions that they may have that they were afraid to ask. Pain management. Nurses are able to provide optimal pain management, pain reduction through diversion. It even decreases the anxiety that is related to the pain itself. Signed consents. All consents must be signed prior to the start of treatment. Any delays could cause a delay in treatment itself. Infection control. Nurses must be the enforcer for hand sanitization to reduce illness and keep illnesses at bay. Department collaboration. Most importantly, it allows for collaboration of different departments within the facility. Now moving on to evidence-based practice. A controlled study at one facility was designed to measure the impact of pet therapy on the use of pain medications by patients in an acute care hospital after total joint replacement surgery. Leaders performing case studies believe that the patients receiving pet therapy will require less pain medication comparing to those receiving the usual customary care. The sample consisted of patients who received total joint replacement surgery. Data was collected from both the documentation and the pharmacy dispensing systems. The data analysis was compared to the group that received pet therapy with the group that received no therapy. They found no significant difference in terms of age, gender, ethnicity, length of stay, post-op day, and surgeon. Patients who received pet therapy statistically significantly less pain medication than those without pet therapy. Time of day had no effect. The largest difference was seen on day 2 post-op. It was determined that pet therapy itself may have resulted in a need for less pain medication because of the intervention's ability to serve as a distraction from the illness, improve morale, relax the patient, and enhances the patient's sense of well-being.
Time to wrap it up.
I hope we were successful at showing you all the benefits of pet therapy and how you can truly impact the lives of so many people, emotionally and physically. Pet therapy can help people of all ages, races, ethnicities, and medical conditions.
Nurses are in the best position to advocate to include pet therapy in their patient's plan of care. If your facility already has a program in place, I hope you will consider allowing pets to visit your patient.
And if it doesn't, then maybe you can be the one to initiate discussions with your facility's administrators to get this wonderful program started where you work. Thank you.
Thank you. Bye.
That's how we reward. That could be for mine when we reward.
Good. Miley, sit. Sit down.
Sit. Miley, sit.
Sit.
Miley, sit.
What are you doing? Sit.
Sit.
All right.
Or you know what we could do? I got a better idea.